Hi, I'm Dr. Abhishek Bali, consulting interventional pulmonologist, Neotech Get Well Multi-Speciality Hospital. Patients usually have a lot of questions regarding COPD and want to know more about COPD. The reasons why COPD occurs, what are the symptoms, how do we diagnose COPD, what are the different subtypes of COPD, the difference between COPD and bronchial asthma, as well as overall management and quality of life of COPD patients. So let's answer the questions, the most frequently asked questions regarding COPD one by one. Let's begin. COPD is defined as chronic obstructive pulmonary disease. It's a common, preventable and well manageable respiratory disease which occurs due to inhalation of chronic noxious fumes and for example smoking or outdoor air pollutions, thick smog which is present in our metro cities, etc. Over a period of time, these noxious fumes and gases obstruct the airways and make it narrow, leading to problems in oxygenation and ventilation. If we have problems in oxygenation, it results in a low SpO2 levels as checked by pulse oximetry, and if we have ventilatory issues, the body is not able to carry out the proper exchange of carbon dioxide in place of oxygen. So we'll divide the causes of COPD starting with the most common, that would be smoking and tobacco use. In women in the Indian subcontinent, COPD is most commonly caused due to biomass exposure. Biomass would comprise wood fire, coal, and usually in the elderly women, this is usually seen in them because in our country, wood fire, biomass was the most commonly used fuel for cooking. So these would be the most two common causes of COPD in different genders. The other causes of COPD which occur in elderly people would be outdoor air pollution and long-term inhalation of noxious fumes associated with the industries, with chemical fumes which are released by certain industries into the atmosphere. So how do we diagnose COPD? How do we come to know whether the patient has COPD or not? Number one, progressive breathlessness. Patient was apparently normal before, and if you are experiencing progressive shortness of breath, especially when you walk upstairs or even when you're walking down a plane, or if you are walking slower than people of your age, you need to probably get yourself worked up for COPD. The other signs and symptoms would be a chronic cough with mucoid sputum production, or if you are coughing out extensive amounts of mucoid phlegm, that would be another indication that you might have a COPD. COPD would also be present in the form of shortness of breath associated with wheezing. Wheezing is nothing but a whistling sound which a patient is aware of whenever they breathe. This occurs due to airway obstruction or the lumen of the airway becoming small. So again, this is another indicator of a potential case of COPD. In case you do have these, please consult your doctor or the Department of Pulmonology in our hospital as soon as possible. Eventually, these patients would end up having difficult or labored breathing, which increases on exertion, that is when they walk or when they climb upstairs, and the manifestations of these diseases would usually present itself in the later decades of life. COPD is diagnosed by very simple tests and usually don't take more than half a day. Once diagnosed, you will be directed towards the proper treatment line, and once you follow the treatment plan, you can actually experience a drastic improvement in your quality of life. Very simple tests such as a few blood tests a radiological test such as an X-ray or a CT, and a pulmonary function test. This helps us to grade your severity and also helps us in starting you on the pre-desired treatment. These are some of the questions that you might have regarding COPD. I hope I have been able to clarify certain doubts and certain misconceptions that you might have had about COPD. If you suspect that you have COPD, or if any member of your family is having the symptoms which we spoke about, visit the Department of Pulmonology, Neotia Getwell Multi-Speciality Hospital, and so that we can work it up and we can start you on the proper directed treatment path. Thank you. I'll see you then.